Good morning. This is Follow the Science Monday morning COVID-19 update. I'm Dr. Paul Juarez, Professor and Vice Chair for Research in the Department of Family and Community Medicine at Meharry Medical College, and also Principal Investigator of the Tennessee Community Engaged Alliance Against COVID-19, also known as Tennessee SEAL. Today is Monday, December 13th, 2021. On December 9th, the Federal Food and Drug Administration expanded authorization for Pfizer's COVID-19 booster to cover 16 and 17-year-olds who are at least 6 months past their initial two-dose Pfizer vaccination series. With both the Delta and Omicron variants continuing to spread, vaccination remains the best protection against COVID-19. The big question about boosting 16 and 17-year-olds relates to the very small risk of myocarditis and pericarditis, and whether the elevated risk of these conditions seen after the second dose of the Pfizer and Moderna vaccines will be seen after the third. But now let's talk about the Omicron variant. With the highly transmissible Omicron variant spreading across the globe, people who test positive for COVID-19 may be wondering which mutation of the virus they have. If you test positive for COVID-19 and are wondering whether it's Omicron or Delta, the test will show which variant you have, but you won't have access to them. That's because results from a PCR or antigen test go to labs at local health departments or the Centers for Disease Control and Prevention for genome sequencing. The process can take up to several weeks and helps public health officials track the spread and mutation of the coronavirus, but results are not returned to the labs. Best available data now show several emerging trends about the Omicron variant. The first is that it appears to be around 50% more transmissible than Delta. With the rapid rate of transmission of Omicron, the World Health Organization is predicting that Omicron will become the dominant variant in many countries by the end of the year. In London, Omicron already accounts for 40% of coronavirus cases and soon will become the dominant strain of COVID-19. Omicron has been the dominant coronavirus variant in South Africa since November. The second trend is that the Omicron appears to be much less severe than Delta. European health officials released a study earlier this month showing that half of the first 70 Omicron patients studied had no symptoms at all, with the other half experiencing very mild symptoms. Reported symptoms are largely flu or cold-like, with headaches, muscle aches, or fatigue. Cases documented in South Africa suggest that persons with Omicron did not experience a loss of taste and smell, and they did not have as much shortness of breath, severe cough, or fever as has been found with the Delta variant. The first death attributable to Omicron actually was reported in England this morning, about a month after the initial detection of Omicron. However, researchers caution that it's still very early and Omicron may not have the same impact in the United States as it does in South Africa, where the population is younger and has fewer comorbidities. The third trend is that the current two-dose protocol that is considered being fully vaccinated is much less effective at protecting people from more severe symptoms than being hospitalized attributable to Omicron. It is now clear that 2 doses of vaccine are not enough to give the same level of protection as provided against Delta. The good news, however, is that scientists are confident that with a third dose, a booster dose, will bring the level of protection back up. Early reports suggest that getting a third dose or booster of either the Pfizer Moderna vaccines raises the level of protection against Omicron to around 90%, similar to the level achieved by the two-dose vaccine regimen used for the Delta. In the United States, Omicron infections have been confirmed in at least 30 states, including Tennessee. The Shelby County Health Department identified the first two cases of COVID-19 Omicron variant on Saturday, December 11th. These results indicate that the variant may already be being transmitted or is being spread in Shelby County and possibly across the state. That being said, we should not lose track that the Delta variant still accounts for more than 99% of new COVID cases in the state. Since the first known cases of COVID was reported in Tennessee on March 5th, 2020, there have been 1,327,453 cases of reported, or 19,608 per every 100,000, just shy of 20%. Of all 50 states and Washington, D.C., Tennessee ranks number 3 by cumulative COVID cases adjusted for population. Just as COVID infections are more concentrated in Tennessee, so are deaths. So far, there have been 17,487 COVID-related deaths reported in Tennessee, or 258 for every 100,000 people in the population. Meanwhile, the national average for COVID stands at 239 per 100,000 Americans. COVID cases are now increasing in 43 of Tennessee's 95 counties, including all of the major metropolitan areas in the state, and decreasing in only 2. The number of new cases across the state over the past 7 days has increased from 1,242 to 2,043, an increase of 39%, while the death rate due to COVID-19 per 100,000 persons in the population increased over 250%, from 3.35 to 8.87 per 100,000 persons in the population. And only 2 of the 2,043 cases reported were attributable to Omicron. So over the past week, reported cases per 100,000 are highly concentrated in counties in East Tennessee. Counties with the highest rates of hospitalizations, on the other hand, are pretty evenly distributed across the state. Clearly, we are now in the early stage of the 5th wave of COVID-19, as reported by cases, hospitalizations, and death. All 3 are now rapidly increasing. Now that the first community transmission of Omicron cases has been detected in Tennessee, we can expect a rapid increase before the end of the year. Vaccine rates continue to increase in Tennessee, albeit slowly. Currently, 56.8% of people in Tennessee have received at least 1 dose of the vaccine, while 50.3% of the population is fully vaccinated. So what to do? Public health officials strongly recommend that everyone eligible to receive the COVID-19 vaccination should be vaccinated as soon as possible. And fully vaccinated individuals should receive a booster dose of the vaccine if at least 6 months has passed since their second dose. Results of early studies indicate that the booster dose provides valuable protection against both the Delta and the Omicron variants. While much remains unknown about the Omicron variant, what is known is that COVID-19 vaccines slow transmission of the virus and prevent serious illness, hospitalizations, and death. The take-home message is that the spread of the Delta variant over the next few months is what we should be particularly concerned about. Getting fully vaccinated will protect you against severe symptoms from Delta, while the booster will provide you with added protection against both Delta and Omicron. For older adults and persons with chronic health conditions, do not wait to get the booster if you are eligible. For those of you who are not yet fully vaccinated, Delta will get you if you do not get the vaccine. For those who are not boosted, get ready for Omicron. So now you have the information. It's up to you to act upon it. This is Dr. Paul Juarez from Tennessee SEAL in Follow the Science Monday COVID-19 update, signing off. Until next week, be safe.